Well, hospitals are feeling the strain of the spread of Omicron as cases continue to surge. And in Ontario, more than 2,400 people are in hospital with COVID-19. That's up by 965 in just 1 week, but down slightly from its record reached Saturday of more than 2,500. Now, of those patients, 438 are being treated in the ICU. That's up by 190 from just last week. Dr. Peter Jüni is the scientific director of Ontario's COVID-19 Science Advisory Table. He joins me now from Toronto. Doctor, thanks for taking the time.
Thanks for having me.
I want to start with some math, so I'm hoping you can help me here. I mean, you've taken a look at COVID-19 hospitalizations that the province is currently dealing with and predicted that if everyone was vaccinated, the number would be much lower. I mean, we talk about a system that's maybe near capacity and saturation. How much better would it be if everyone was vaccinated?
Oh, I think the contrast becomes more apparent, or most apparent, when you really think about if everybody were vaccinated or everybody were not vaccinated. But what we need to be aware of, right now in the situation we're in, we probably would have 250 people on our ICUs rather than the number that you were referring if everybody were vaccinated. But the point is, if nobody was vaccinated, then we would have 2,500 people on our ICUs. That's the big contrast. And we need to be aware of that. The point is, it was not for nothing what we did in the past. We made it a big way forward, and we only will be able to cope with the situation, sort of, because our vaccine rollout was so successful.
So just to look at that math, you say you'd have about 250 people in ICU if we had full vaccination. Right now we have 438 in Ontario. So we'd essentially cut it in half. And if you cut that in half and reduced hospitalizations by similar numbers, would Ontario have to cancel electives and surgeries and delay treatments if we freed up this capacity in the system? Will we be able to function?
We need to be very careful. Right now, the major challenge we have, in addition to ICU, is also the wards. And right now, what we're seeing is that the risk of hospitalization is reduced by 2 to 3 vaccine doses, roughly by a factor of 5, which is good, but it's not the 10 to 20-fold reduction as we see with the ICUs. So we would still need to tread carefully, but much less carefully again. So, for hospitals, we would, if everybody would be vaccinated, we would still have roughly 2,000 people right now in a hospital with COVID-19. But again, remember, if nobody were vaccinated, the numbers right now would be 9,000.
Okay, so last week the federal health minister spoke about the idea of mandatory vaccines, and we've heard some premiers, Jason Kenney, Scott Moe, saying no way, we're not going to go there, but Blaine Higgs in New Brunswick saying this is something we need to consider. Is mandatory vaccination policies the way out of this?
Look, I'm not a politician, and we need to be aware of that our case is different now than before with Delta and with Alpha. The point is, with Delta and Alpha, we had a really good protection of vulnerable people through vaccinated people. Why? Because everybody was protected against infection as well. That's not the case right now with Omicron that much. If you have had 3 doses, again, you get some protection, which is quite good against infection as well. But right now, this is all about preventing serious outcomes, including hospital and ICU admissions. So the case for vaccine mandates on a larger level is certainly less than what we had before. And then there are all these political considerations that I'm incompetent to talk about even.
Okay, I hate that you said you're incompetent to talk about it because I want to ask you a political issue. I mean, just wondering, as a doctor and as an advisor on how to deal with this, I mean, how do you react when you hear politicians talk about the need to accommodate the unvaccinated when what you're seeing in the wards and in the ICUs is so much of it is a result of people who are not vaccinated? So how do you respond on a personal level to that sort of a political argument?
Look, we have 2 different populations of unvaccinated people. We have a relatively small but vocal group of people who has a cult-like belief that these vaccines would be tremendously bad for them and for society, etc. We don't have to talk about those. That's not the challenge. But what I feel is a really tremendous challenge is we have a lot of people out there who have experienced systemic racism, were disenfranchised, etc., who are justifiably mistrusting the system. And we have a lot, like here in Toronto, we have a lot of in the Indigenous community who haven't been vaccinated yet. And we need to make sure that we can change what's happening there. That's the big tragedy we're talking about.
So I wonder, when you look at the situation and you look at where we are in terms of hospital occupancy and what we know about the rate of hospitalizations, can we divine from that how close we might be to the peak of the Omicron wave, when this might be over, and just how much longer our health system can keep going the way it's going?
Yeah, it's very difficult right now because our case numbers are meaningless. No, our testing system was overwhelmed, the strategy has changed, etc. But as a matter of fact, the modeling consensus table just had a meeting, and we looked into that. We're also looking into wastewater, etc. It's relatively likely that, second half, somewhere in second half of January, we will see this plateauing, most likely. But, it's very difficult, and my colleagues who are much more knowledgeable if it comes to mathematical modeling than I, are working on that. We just need to be aware of this time, we can't do miracles because we really lack calibration, and we just need to triangulate the situation. We will see what's happening right now. The good news is we see the mobility here in our province, and I believe also in other provinces, go down, meaning people really do the right thing and meet less. Mobility is a marker of contacts, and this will help together with the restrictions that we're seeing, of course, at different levels in different provinces.
When you talk about mobility, and sorry, I'm going to veer back into the world of politics now, I apologize for that. There is a controversy here about the use of cell phone data to track people's mobility. At least a couple of the parties are worried about this as a privacy breach. But from a public health perspective, how important is it to track the mobility to get a handle on this?
Oh dear. First of all, these data are publicly available data from Google and from Apple. No, so if politicians actually talk about that this is a privacy issue, then I don't think they've understood the nature of the problem here. No, and I think it's really important, again, what this helps us to understand is whether what we're doing actually just impacts behavior of people. We need to keep in mind, this is just a measure of it. This is not directly the contacts that people are having if they sit 3 meters apart in a restaurant in the same room. That's not what we're talking about. But we see this, and then are able to indirectly just understand where we are right now with the behavior of people. This is tremendously important from a public health perspective.
Okay. Dr. Peter Jüni, thank you so much for your time.
Thanks for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.